Singapore has reported nearly 9,400 new COVID-19 cases. This comes a day after it logged its highest daily tally in more than 3 months. There is one fresh death, a person aged between 70 and 80. Now, the week-on-week infection ratio continues to climb. It is now at 1.65, and this indicates that infections are doubling in less than 2 weeks. Now, there are more than 450 patients in hospital, 7 in ICU, while close to 50 require oxygen support. There are also about 600 new imported cases. Well, let's look deeper into the numbers with Associate Professor Swee Vice Dean of Global Health and Program Leader of Infectious Diseases at the NUS Swee Hock School of Public Health. Prof. Su, at this point, we've given all those latest numbers, and I imagine many people might be saying, here we go again. But do we have enough information at this point to say whether this wave is going to be worse or better than previous COVID-19 waves?
Thank you. I wouldn't say this wave is different at this point. Obviously, we don't know what's going to happen for sure. But if we look at Portugal and South Africa, which are ahead of us in the epidemiological curve, their BA5 and 4 waves crested and fell in under a month. So if nothing changes in Singapore, I think we should follow a similar path. And because we had a pretty bad Omicron wave earlier this year, that's a blessing in disguise because it results in some degree of protection against the BA4 and 5 variants. So I don't think we will see much higher COVID-19 cases compared to before.
So can I just press you to be a little bit more specific in terms of when you think daily projections might peak at this trajectory, and how long do you feel that the wave would last past August?
I guess credit for this goes to my colleagues who do the mathematical modeling at the school. But again, everything depends on what's been happening around the world. At this point, as I mentioned, the waves in South Africa and Portugal fell within a month. So I think we should see the wave crest and fall perhaps in the second half of July.
Prof. Su, the government says that for now it plans to stay the course, not tighten curbs at this point. So is it fair to say that if the infection rate does go up, even above 2, it's 1.65 at this point, but ICU rates remain low? It's safe to say that we can continue with business as usual?
I think it's not just ICUs because during the Omicron wave earlier, the ICUs were, I guess, not full, but nonetheless, the hospitalization rates were high. So I think if the hospitals become full, then we will need to tighten measures against COVID-19. But if it doesn't, then of course we can carry on as usual.
I'm wondering, are there any particular groups that we need to be concerned about? Because we spoke to other experts today, and one of them pointed us to a study that showed that the BA2 strain being more severe for children. What will happen if BA4, BA5 becomes the dominant strain in Singapore?
So there's no need to be concerned about BA2 in that sense because I think it will soon be replaced by BA5 and 4. We don't exactly know how lethal is it for children compared to the earlier variants, but nonetheless, the experience from Portugal and South Africa and other countries around the world with the same wave as us seems to suggest that it isn't more deadly in children. So that's not quite a reason to panic at this point yet.
Yeah, I'm wondering, because is it really a case that we should be looking at each variant and how each variant evolves, or, to be able to determine the severity of it? Or is it because we're reporting the cases different? In 2020, 21, everybody reported their COVID cases, but now we're only looking at the more severe cases. So should we be really analyzing all these details and statistics through that lens?
There will be people who are doing this analysis anyway. I think most of us shouldn't. because we, in some sense, can trust that there will be experts at the Ministry of Health who will be surveying this data from around the world, and there are experts around the world who are analyzing such data as well.
Now, together in tandem with COVID, we're also having a fairly serious dengue outbreak going on. How do you see that developing, and would it make the COVID-19 surge in a way more complex to manage?
I just had a look at the figures, and the dengue cases are currently going down, but it could just be a blip because normally dengue cases fall in the third quarter of the year. But yes, if there are more dengue cases, then there'll be added pressure on the hospital beds. Otherwise, the two diseases generally don't impact each other that much.
Well, it's good to hear that confidence coming from yourself, Associate Professor Swee. Thank you for speaking with us there, Professor. Sue was from the NUS Assoc Swee Hock School of Public Health.